Hi, my name is Acharya. I'm consultant orthopedic surgeon specializing in surgery of hip and knee at Warrington. Today, I would like to talk to you about anterior knee pain. It is a very common condition. It happens at two different ages. It is commonest in young and middle-aged females, and almost 25% of the runners will at some stage have anterior knee pain. So what is anterior knee pain and what causes it? It is pain in front of the knee, near the kneecap area, or just next to it. Nobody knows exactly the root cause of anterior knee pain. It can happen because of various abnormalities. A lot of research has gone into this. Some people or some researchers feel that it may be related to overload of bone or cartilage. Some believe that there is reduced blood supply to this area in certain individuals. It is also attributed to nerve related pain, and that's why some patients feel it more commonly during winter or cold weather. However, some researchers now believe that all of us function in a zone of or envelope of comfort. We all may have some minor abnormalities in the body, but we can function very well and we can cope very well. However, when there is a final straw as a result of either recently putting on some weight or some injury, then we fall outside this zone of comfort and the patient then has anterior knee pain. So, how does a patient present to a surgeon or to a consultant? The pain is mostly in front of the knee. There is usually not much in the way of swelling. It is a dull-like discomfort, and the patient especially notices it on stairs. Coming downstairs can be especially very difficult. Usually, the pain is made worse by sitting in a small cramped up space for a long period of time, such as watching movies or sitting down for dinner for a long time. The patient will need to move the leg and the knee may feel stiffened after driving for long distance. So, how does one treat anterior knee pain? During the consultation, I would evaluate the knee, make sure that there is no fluid in the knee, there is no other abnormality such as meniscal tear, there is no evidence of any ligament injury. I will then check the kneecap and also check if the surrounding muscles, whether they are tight, whether there is any weakness of the muscle. Also, I would focus on the core muscles and the posture of a patient while doing a squat or single leg squat. One may feel, why is core so important? The core, which involves the muscles around the torso and pelvis, create a stable platform and the knee can then work very well. If the platform is not balanced, the knee muscles have to work much harder and then the patient has more pain because the knee is working much harder. So it is really important to improve the core balance. It is improved to improve the muscle strength of the core and stretch the double joint muscles so that the knee is not working too hard. Some patients may feel that I already have tried physiotherapy. Well, the physiotherapy for anterior knee pain is a specialist field and you have to focus on various aspects and not necessarily only the knee. So it is worthwhile seeing a physiotherapist who specializes in this. So what are the treatment options for anterior knee pain? Once I've reviewed the patient, we can then arrange further investigations. And the investigations sometimes are merely to check that the rest of the knee is normal, that there is no abnormality within the knee that needs keyhole surgery. So once we rule out meniscal tear, ligament injury, damage to the cartilage which may need addressing, if the knee is entirely normal, then the mainstay of treatment is without operation. Of course, I can offer you injection to reduce the pain, reduce the inflammation. This injection is usually that of steroid and local anesthetic, and it can work very well for up to 3 months. Whilst this injection is working, then you can participate in yoga, Pilates, core strengthening exercises, and physiotherapy. So you are on the road to recovery. A little bit of weight loss can also help a long way. If patient has exhausted all the treatment options, including physiotherapy, weight loss, steroid injection, we can again have a look at the scans. And after addressing this without operation for 6 months, if the pain continues, we can see whether any surgery can be performed. The surgery may involve shifting the kneecap either south or moving a small piece of bone called as tibial tuberosity to offload the patella. Occasionally, the bare area of the kneecap might need drilling. However, usually any surgery is not recommended in first 6 to 9 months while we are trying treatment without operation. The main aim is to control the pain, and I am sure with the help of excellent team we can provide you with the best treatment and get you on the road to recovery.